Kieran, you served in East Timor and in Afghanistan as an army doctor. You now practice as a GP. Mate, how difficult is it for vets to open up?
Oh, I think it's very difficult. So a lot of these guys and girls have lost their careers if they've been medically discharged. There's a big trust issue for various reasons. And so for them to come out and accept the fact they may have problems, culturally for them is very difficult. And they're trying to find a GP or help, family, friends, that allow them to just open up and a lot of them avoid their problems. They don't want to face them, so it is a real issue. And for GPs, the front line, you don't have much time, you're very time poor, and so trying to just get that trust that you're not going to pay them off and not help them is very difficult. Yeah.
What are some of the early signs? What are some of the symptoms, of PTSD?
A lot of people have, again, physical signs, so which I see in my practice, and my practice is the more contemporary, younger ones. So they may have sleep problems, usually anger issues, big anger issues. Some of them have alcohol or drug abuse, especially guys that have transitioned out early. And then the heart attacks and that sort of things we don't see as much because that's a risk, but it's usually things like sleep and family problems. So a lot of, not just veterans, but even the domestic violence or the first responders, police, fire, ambulance, they really struggle with their families. And that's often where we'll see them first, is they get pushed to us by friends and family.
You helped to develop an online training program for GPs. How will this help identify patients, who potentially might have PTSD?
I think it'll help a lot. So GPs, as I said, are very time poor and may not necessarily have a lot of information about or a lot of knowledge about PTSD, but they see a lot of patients with all the physical conditions. And so, again, giving them the ability in a short sound bite of knowledge, which is what the study's designed to do, so they can then go, I've got a patient, I've got PTSD, I'm not necessarily scared about the PTSD because I understand a bit about it, but I can manage all of the physical stuff because that's what I do. And if need to, I can refer them on to psychological support. So it's getting an understanding of it's not scary, and they've got the skills now and a bit more knowledge to actually help them, which is what they need. Yeah.
Miriam, I know your team have been working very hard on developing and finding out more research into this PTSD, a terrible infliction for so many Australians. So keep up the good work. Thank you very much, guys, for coming in and chatting to us today.
Thanks so much.
Thanks, Miriam. Thank you, Kieran.